Our next panel is an amazing group of experts. We're going to continue the discussion of how to build your own response plan and resources that are available to you. We will have William Condon begin. He's our emergency manager of the Broward County Human Services Department. Then we have Natasha Strokin, who will speak next. She's the Director of Emergency Preparedness for Memorial Healthcare System. Then Brian Davis, who's the Division Chief Emergency Management Director for City of Sunrise Fire Rescue. And Carl Taylor, who's the President of Extreme Crisis Healthcare, XCH.
Hopefully you found that first panel to be quite informative. I just wanted to review a couple of things that you probably heard. Emergency preparedness, which is really the theme of what we're doing here, and they talk about preparedness kits, and the Red Cross was pretty detailed as far as the things you need to think about when it comes to being prepared pre-storm season. But also, we're talking storms. What are, just shout out some answers, but what are some other reasons why you may need to evacuate your home and you may need to seek shelter other than just staying in your own home? What are some of the other things you might think about? Fires. Floods. What else? How about train derailments? How about chemical spills? How about acts of terrorism? How about water main breaks that might have to evacuate areas? These are all things that can happen any time of the year, and a lot of those things are not what we call no-notice events. Hurricanes, we usually have that 5-day window. We have that time to plan, and we get to the Emergency Operations Center. We've got all this planning time, and we have time to communicate to everybody. But how about when it's a train derailment? We didn't plan for that, did we? You know, and all of a sudden now we need to evacuate certain areas because there was some kind of a hazardous material on that train. So there's a lot of things to think about, and that's why emergency preparedness is not something that you do in May in preparation for the June 1st hurricane season. It's something that you really need to think about 365 days a year. Okay. The vulnerable population registry that I know some discussion was talked about. Super important and a very easy thing to get registered for. And you can define vulnerable to really any way you want, but I mean, if anybody that you know, and if you're caregivers for people, and I think the question came up that was perfect as well, is to get people registered on it. But also, to her point, let them know that you registered them on this thing so that when they do get that phone call, they don't say, what are you talking about? But make sure that you have that communication plan as well. The special needs shelters are a wonderful resource that we have available here in Broward County, but I'm going to really talk more about everything else. Okay, so when we talk about those plans, there are three things to really think about, and there's three different ways that you can think about evacuation. One is get out of town. Number one, find a place to go where you're out of the path of the storm. So if you've got family members that you can go visit in Georgia or South Carolina or wherever it may be, that you can get out of the path of the storm, that is absolutely the first thing you should really think about and really should be your top priority. Now, during Irma or during some other storms, everybody here down in South Florida says, oh, the storm's coming. I've got a friend in Orlando. Let me go to Orlando and stay with my friend. You know, and guess what? The path of the storm changed. It hit Orlando. Now they couldn't get out of Orlando, and they should have just stayed in Fort Lauderdale the whole time. But again, if they could have gone to Atlanta or someplace else, that would have been certainly the proper way to do it. So just, you know, think about that as really your number one plan. Number two, we talk about sheltering in place. And I know that we're going to have some discussion later from Deputy Chief Davis about sheltering in place when it comes to the elderly and the vulnerable population. It's not something that really is recommended for that population, to be honest with you. That's typically the number two, is shelter in place. If you have a home where you have a facility that you feel can be safe enough to stay during a storm or during some type of an emergency operation, then that is always a good option. But hey, do you live in a building with an elevator? Guess what? There's no power. Are you going to be able to get up and down the stairs? We've seen situations. There was a major storm in Texas a couple of years ago where there was so much flooding and people stayed in their high rises. Well, guess what? The first floor of the high rise was flooded. So first of all, they had no elevators, but even if they went down the stairs, they couldn't even get out of the building. They had to start bringing in supplies by boats. So this is not really a good alternative when you really think about sheltering in place. And then the third is the county-run evacuation shelters. And that's really my responsibility here at Broward County. I work for the Human Services Department of Broward County in the Emergency and Mass Care organization. And my main responsibility is to make sure that you all have a safe and secure place to go if you need to evacuate. We have 35 general population shelters in Broward County, and we have 5 special needs shelters as well. And then out of those 35 general population shelters, as Doug mentioned, 3 of them are equipped to be pet friendly. Also, as a note to the pet friendly shelters, these are not drop-off shelters. You don't drop off your pet and then you go somewhere else. You must stay at that shelter with your pet. So that is just something to keep in mind. That some people just think, oh, I can go bring my dog over to the pet-friendly shelter and then I'm going to go stay with Aunt Mary. No, that's not really what the pet-friendly shelter is about. So just keep that in mind as well. But what is a shelter that we run here in Broward County? It is a safe and secured place for you to go in the case of an emergency and evacuation. That's what it is. Okay? We are going to have all the resources available to you that you are going to need for the duration of that evacuation. That means we're going to have security on site, we're going to have some medical services available on site, and we're going to have food. We're going to give you 3 meals a day. Some of the things to think about is there's certain things we don't provide. We don't provide cots, we don't provide beds, we don't provide water bottles. I mean, so certain things you want to make sure that you are prepared to bring yourself. If you really want to be comfortable in a shelter, and by the way, shelters are schools, and the primarily dormitory is a gymnasium. So the rule of thumb is that the average person gets 20 square feet in an evacuation shelter. That's 5 feet by 4 feet. So think about that, right? That's the space that an individual gets. Now, if you have a family of 4, then you get 4 of those, kind of areas. But it's not a lot of space that you really have. So make sure that you are bringing the things that you need to make yourself comfortable when you go to a shelter. That could mean you can bring a blow-up mattress. Don't bring a king-size blow-up mattress. It's not going to fit in your 5 by 4 little space. I mean, and you're laughing because we were just talking about it. People show up with king-size stuff. We had somebody show up at one of our shelters during Irma and he brought his own microwave oven. And not even just blow-up mattresses, but they were bringing in regular mattresses. They had people showing up in U-Haul trucks trying to bring king-size mattresses in the door of the shelter. Does everybody know what's coming up on July the 8th? Amazon Prime Days. It's coming up on July the 8th. I checked this morning just so I had the information for you. A twin-size inflatable mattress with a battery-operated pump is $30 on Amazon. Everybody in this room should go on Amazon July 8th when it's 40% off and go buy yourself one. Because it's something that's inexpensive to have, and it's going to be, a lifesaver to your back when you have to go to one of these shelters and sleep in a gymnasium. Bring a sleeping bag, bring your own blankets. When I mentioned we really don't have water bottles, but there's plenty of water at these schools, but make sure you're bringing your own refillable water container so that you can, refill your water. We are going to provide you 3 meals a day, but these are going to be run by the school cafeterias. So you're basically getting cafeteria food at the schools. We cannot really always depend that we have full power in these facilities. Therefore, a lot of it's going to be cold meals. They're not going to be hot meals. So keep that in mind. It's going to be a lot of sandwiches. If you have special dietary restrictions, bring that food with you. If you're gluten-free, you better bring your gluten-free stuff because these kitchen staff are not going to be available and capable of doing those kind of things. We do have backup generators in these shelters, but it's not like in our special needs shelters have very significant and robust battery backup or generators for those facilities where they can operate special needs shelters 7 by 24 full power. On our general population shelters, we have generators there, but it's only for emergency lighting, refrigeration in the kitchen, and some electrical outlets. not even all electrical outlets. What's the one thing I didn't mention that these generators power? Air conditioners. Okay, so even though we will have electricity at these shelters, just keep in mind that this is not going to the Ritz-Carlton. This is going to a gymnasium. But we are going to keep you safe. We're going to keep you secured. We're going to keep you fed. You're going to get all the essentials you possibly need. We're going to have BSO on site. We're going to have EMS there for during our lockdown periods. And I'll just mention a little bit about lockdown. I think it was mentioned before that the buses can't operate once we get over 35-mile-per-hour winds. That's when we go into what we call our lockdown. Once winds get over 35 miles per hour, basically the county goes and shuts down. That means that you're not supposed to be out on the road. That means they get the buses off the roads. That means they get the ambulances off the road. We start to go into that lockdown period. You better make sure that wherever you're going, you're already there before we get to that point. Because once you get to 35-mile-per-hour winds, basically the county is going to be shutting down. So just keep that in mind. And then once the winds die down below 35 miles per hour, it'll get reopened again at the request of BSO. They'll make those decisions. Communications was talked about a little bit here as well. I spent many years in the wireless telecommunication industry, and I'll tell you right now, one of the things about cellular technology and cell towers is they don't do real well in the wind. They don't do real well when there's no power. But when they do restore service, text messaging is so much better than trying to make a phone call. Because one thing phone calls will do is they'll overpower the grid, they'll overpower the towers, and the chances of you getting your calls through are not going to be really high. But text messages almost always go through. So just keep that in mind as well. We talked a little bit about refrigerated medicines for animals. It's the same thing for your medication as well. If you have refrigerated medications, we do not have refrigeration on site for that, but we do have ice machines. So bring your coolers. If you have to bring refrigerated medicines, by all means, bring them with you. It's essential for you to survive. But just make sure that you bring yourself a little cooler, and if you need us to give you some ice to keep that cooler cool, by all means, we're there to help you do that. But just remember that that is also something important to have. And then I think one other thing that was mentioned was important documents, and make sure you have those with you as well. There's some great resources in this book. You'll see in the back there is a list of all the emergency shelters. And one of the things I really want to point out, all 35 shelters are listed in here. Don't assume they open. Okay? Just because you say that, I'm going to pull out my little list here and see that, hey, Sunset Lakes Elementary School is right down the street from my house. I'm going to go there. Well, you need to make sure that Sunset Lakes Elementary School is one of the shelters that's open. Because we open shelters based upon the size of the storm, the significance of the storm, and all those kind of things. We're not going to open up 35 shelters from day one. Typically, we'll take a look at what's going on with the storm, and we may say, let's get 6 shelters open. Let's get 8 shelters open. Oh, those 8 shelters are getting full. Let's open 3 more. Let's open 4 more. So you need to go to the website, and it's broward.org/hurricane. Everybody should bookmark that on your computer and bookmark it on your phone. It is a mobile-friendly website, but if you go to broward.org/hurricane, you'll see right on there, if you click on shelters, it'll show you which shelters are open. There'll be a little green circle next to the ones that are open, and a red circle next to the ones that aren't. So then you're not going to a shelter assuming that, hey, I'm going to go to this school, they got a shelter there, only to show up and go, where is everybody? Why is there nobody here? Because that shelter didn't open. You need to make sure you're going to the right ones. So I'm going to turn it over to Natasha for the next segment, and certainly available to answer any of your questions. Because I did want to talk, one more thing I wanted to just mention, it's real important, is FEMA, okay? I'll talk about FEMA today. We don't know what FEMA is going to look like next year, but individual assistance when it comes to FEMA. When a storm hits, when any of these emergencies hit, register for FEMA, period, end of story. I don't care if you own a $5 million house in the water or you're renting an apartment, register for FEMA. There's a lot of assistance post-storm. A lot of people don't realize that. You just put in an individual assistance application. You want to get yourself registered. What services that you're going to qualify for it all after the storm is going to be determined, but make sure you register for FEMA. It's called individual assistance, and if you just go to FEMA.gov, there will be a lot of information on there. Typically, one of the things that almost everybody qualifies for what the numbers were in the past is you immediately get a check for $700. And it's like literally direct deposit within days after a storm. And that is to get you those essentials that you need. For example, your house was without power for 3 days. Well, guess what? You could throw away all that food that was in your freezer and refrigerator. Right? At least that $700 is going to get you to Publix to get some of that stuff restocked back in your refrigerator. So make sure that you take notice of what FEMA has to offer. And again, it's called individual assistance, and you want to make sure that you take advantage of that.
Good morning, everyone. So I'm in an interesting part of the program where a lot of the things have already been covered, but that's okay. Brian's got it worse than I do. So what I'll want to do is speak specifically to the higher level of care. You've also heard it referred to as medically managed facilities, and what that looks like for the hospitals. And really what I'd like to do is set expectations and also be able to answer questions. So I am here on behalf of the Memorial Healthcare System. But we also work with Broward Health, and I see that they are in the room, as well as Cleveland Clinic and Holy Cross, which we all participate in the medically managed or higher level of care. So for Memorial, we have, as you know, 6 hospitals. We have 1, soon to be 2 freestanding EDs, and several facilities throughout the region, and really the South Broward Hospital District. So when we look a little bit south of 595, county line, and then east to west. So really South Broward is one district, North Broward is our other district. During regular blue sky days, we are separate systems. We work the way that businesses work. However, during a storm, during a disaster, we become one and we collaborate. So everything that I'm gonna say now, for the most part, will also apply to the other hospitals participating. But as we do the assignments, as you know what your particular circumstances are gonna look like, then that hospital district, that hospital will be able to give you more information. So pre-storm, we work with Broward County throughout the year. And one of the main things that we wanna do, and why we're very happy to be here today, is to educate on what to do in blue skies to make gray skies a little bit easier to work with. We mentioned borders. So we have the 3 levels of sheltering. We have the general population shelter. We have the special needs shelters. And when we get to the higher level of care or medically managed shelters, when we speak about borders, we are an extension of the shelters. So it's not necessarily that if you are assigned to a hospital, that you are assigned as a patient to be admitted, is you are still an evacuee. You are still an evacuee for the county. It's the location is a little bit different. And where the triage works with the health department to say that your level of care exceeds the need of the special needs shelter, that you need to be placed at a hospital, it's because if you decompensate during the storm, that the level of care that you're going to need is not necessarily going to be available in the special needs shelter. And that's really the difference, is that it is the same type of sheltering expectation. The environment is just a little bit different, so that if for whatever reason you aren't able to maintain that level of care, or your loved one is not, that we're able to respond very quickly and bring you into an emergency department and make sure that you get that level of care that you need. In addition to the higher level of care, we also accept certain pregnant women, because we know that when the barometer drops, the birth rate goes up. So if you are 38 weeks or above and pre-registered to give birth in one of our hospitals, there are 3 hospitals that offer that service at Regional, West, and Miramar, then we bring those individuals in as well. We also, because of Joe DiMaggio, have pediatric higher level of care boarders that we also accept, that again reside within the South Broward Hospital District. So it is very much a larger population during a storm. And because of that, we do not accept spontaneous boarders. So if you are not registered with the county, if you have not been triaged to a higher level of care, and you come into the hospital right before a storm and say, well, I want to stay here, or I want to bring my loved one here, we cannot accommodate. So we are going to refer you back to that 311 call. and we're going to have you triage, and then they're going to determine based on your need whether you can be in a general population shelter, in a special needs shelter, or needing to be in a hospital. The accommodations within the hospital, while it's not a gymnasium, as fun as that might be, it still potentially can be a congregate care setting. And what I mean is that you're not going to necessarily be in a hospital room with a hospital bed. Depending on the level of care, you can be in an auditorium, it can be in a meeting room, honestly, it could be in a hallway, depending on what your needs are. Generally, what gets triaged into the hospital is going to be continuous oxygen. So if you are on a CPAP, you potentially could be in a special needs shelter. If you're continuous oxygen, if you are completely dependent on electricity, because the one thing that we do have is continuous electricity. All of our hospitals have redundancies so that we can be under full power. But if it is something other than that, you very well, again, could be in a special needs shelter. We are going to accommodate you. We know we'll have power, we know we'll have oxygen, and we know we're going to have care. The same thing as with medications is, although we do have pharmacy, we cannot take your medications and put them into our pharmacy with medications being dispensed. Our pharmacists would get in all kinds of trouble for that. So it would be the same. Bring your cooler, we can provide you ice, but we cannot necessarily take your medications. We will try to the extent possible to have a refrigerator that is just for your medications. However, that will be an open area. So if somebody opens it up and they think like, that insulin kind of looks like my insulin, close enough, we don't necessarily want to do that. So we do ask that you bring those, and we'll provide ice. We will provide monitoring and assistance with medication dispensing, in that we can, for example, help with insulin. If your loved one, if you can't necessarily see how much to pull, we can do that. What we cannot do as a boarder is prescribe medication. We cannot do diagnostics. So if there is new medical treatment that is needed, that is not something that we would be able to do in this scenario. If you needed that service, then we would be happy to bring you in. We would then admit you and provide services. So it's very much helping you with the daily living activities. We can help with getting you where you need to be. We can help with ambulating. We can help with feeding. But it is not necessarily going to be a full patient experience. But you will have medical professionals there. We will be able to help you. We will be able to assist you and make sure that you have everything you need to stay as healthy, if not healthier, as when you came in. We accept service animals, and that's ADA approved designated service animals. So dogs and mini horses. And if anyone has a mini horse, I really want to see it. I have been dying for years to see a mini horse. So if anyone gets one, just snap a picture for me. Okay, awesome. But you will be, so you would be placed in an area where you would be able to take care of your animal, but you would still have that responsibility. So we do ask, please come with one adult caregiver that is going to be able to help you. Again, we will be monitoring, we will have medical staff there, but we will generally have also a full hospital. We will have pregnant boarders, we'll have pediatric boarders. So we do ask that you bring someone to be able to help you with whatever needs that you have in between. So it could be helping to go take care of the animal, it could be helping with feeding, going down to the cafeteria. So please bring someone with you. Before this, I did work with the Department of Health for the state. I worked in South Florida. I was in Miami-Dade during Irma, Maria, and all of those times. And we saw that there were a lot of issues and a lot of comfort that could have been provided by having a caregiver. Just like the pet-friendly shelters are not drop-off centers, neither are the regular shelters. So we encourage you to make sure that as you're taking care of your loved ones, as you're taking care of your clients, to have someone go with them and not necessarily drop them off at the shelter and then come back and get them later. And unfortunately that has happened in the past. So if at all possible to educate, we've said it over and over, I'm gonna say it one more time, this is a lifeboat, not a cruise ship. So having your caregiver with you is going to make sure that they are going to have that comfort level that they need. During the all clear, when we receive an all clear and we follow the county, so from the lockdown to the opening of the shelters, once the shelters open for the county, we'll open our shelter as well and our spaces for our boarders. And then upon all clear, we'll work with Elder Affairs, we're gonna work with Andrea and her team to be able to do the discharge planning. Once we know that the shelters are closing, it is a possibility that when you leave the hospital, that you might get moved to a step-down shelter, because at that point, electricity will be stabilized, we'll have the oxygen resources in place. So we'll make sure that you're not going to be discharged without having somewhere safe to go. Pharmacy, we do participate in the emergency dispensing, so that at the time of a declaration, you can come in and get your 30 days of medications just in case. That's something that we do in our outpatient pharmacies as well as for anyone being discharged. The one part that we do recommend, especially if for the remote chance that someone is not going to have a caregiver, as part of your kit, have a copy of your prescription, or at least a copy of the bottle. This will also help for dispensing, because we have had cases where someone has their insulin and they can't remember exactly how many cc's they're supposed to have. So you'll have the client telling the caregiver, it's 50, or maybe it's 40, or maybe it's 20, and we want to make sure that we can help you help yourself, you can help us help you. Have copies of your prescriptions, have copies of the doses, so that if we are helping you, there's not going to be a question. No one necessarily wants to be admitted while they're a boarder, so the more information you have, the more information you can provide, the easier it's going to be for us to take care of you during the event. I think that is my time. I'm at 30 seconds left.
30 seconds left.
Okay, so I'll be happy to answer any questions, and I will turn it over to Brian.
Holy cow, there's nothing left, so this is going to be really, really quick. Who here's from Sunrise? Everybody from Sunrise? That's it? Sunrise residents? I thought there'd be more. I thought it'd be mostly Sunrise. So anyway, to introduce myself again, I'm Brian Davis. I'm a division chief here in the city of Sunrise with Sunrise Fire Rescue. But I wear two hats in the city. I'm also the emergency manager, which is more of over the entire city, more so than just fire rescue. In the city of Sunrise, that is how the org chart kind of works out. So emergency management falls under with fire rescue. So I was voluntold that about 4 years ago, and I've been in this position since then. My primary focus or my responsibility as emergency manager is working with mitigation. I coordinate responses and recovery when we do have storms or anything large scale as a whole, but usually this time of year we're focusing on hurricanes and storms. Part of that involves working closely with Broward County Emergency Management, Broward County EOC, because we actually do a lot of sharing with like situational awareness. We also work with different kind of response, resource sharing, and some FEMA aspects and stuff like that. So being that we are just a city, we do rely heavily on Broward County EM to help us out here. We also work with Broward County EM to notify of any like public hazards, public safety, road closures, those kinds of things, not only for the counties, but as far as here locally as well. We also work with public notification systems and those kinds of things to keep you informed of any type of hazards and stuff that might be happening in the city. We do a lot of assistance through our community paramedicine program with this. We're working with nursing homes for all the storms. We also have a very vibrant CERT team, which we have a member here today, correct? Yes. We also we have do pods, anybody know the point of dispensaries and stuff. Sunrise has always been really active in that, especially like through COVID. We do a lot of things as far as doing pods for testing and vaccinations, as well as food delivery and stuff. So Sunrise is really active in that. And we also work, we're very robust in working with the Chamber of Commerce and stuff. Most people don't think about it, but there are a lot of businesses and stuff that need our help, and we work closely with them here in the city as well. So that's basically what I do on the EM side of things, especially when it comes to storms and those kinds of things. More of my day-to-day operation with the fire, and I was going to give you the kind of the good with the EM side. The fire and the storm, there's not a lot of good news I'm going to give you. I'm going to tell you the bold reality. I've been on the street, if you want to call it, through several hurricanes, which were previously mentioned in 2004, 2005, being Wilma. I had the honor of speaking with Senator Rich as far as reminiscing about Hurricane Wilma. I had a wonderful experience. I was at Station 72 on Oakland Park for Hurricane Wilma, and we were told it was it's on the coast. It was on the Yucatan Peninsula. It's going to take a little while. You know, don't worry about it. You're going to be able to go home. And I got stuck for another shift. People couldn't get in. It sped up and intensified on a very short notice. We were sitting in Station 72, the crew and I, and we lost the roof to the station while it was still going on. And so we had 55-gallon buckets out in the bay by the trucks. So we had like a reverse, you ever see the old movies, the Bucket Brigade, where they're taking the buckets and throwing it on the fire? Well, it was actually the opposite. We were taking the buckets and filling them full of water and throwing them out the side door because the water was actually filling up the station. So Wilma actually passed. I don't know if you guys care to hear about it. So the storm passed, and it came time to run the calls. And so dispatch started dispatching calls to us, and we didn't think about the bay doors, the big metal roll-down doors. Well, all of the doors had bowed in so far that it slipped off the tracks. So even though we were told to run the calls, it took us about a half hour to finally get the bay doors up enough so we could get the trucks actually out of the bay. So those are just some, one of the unexpected stories of Hurricane Wilma on top with the phases and stuff here. It took really quite a hard lick. Irma as well. I'm sure you guys are familiar with the nursing home situation and stuff that went on with Irma. So anyway, but just to talk from a fire standpoint when it comes to hurricanes, like it was stated before, Broward County stops a lot of their operations at 35 miles an hour. From a fire rescue standpoint, we do not provide service when sustained winds reach 50 miles an hour. It becomes too dangerous for our trucks. Our trucks are top heavy, or just naturally top heavy, so it's too dangerous for us to respond. So what does this mean to you? We're not coming. It's just a bold reality, and it's a heartbreaking fact because our guys want to respond, they want to help people, but the bold reality is it's just too dangerous to be out on the street. So I encourage anybody that's like also been stated before, have a plan. Make sure the plan is in place and practice that plan and put that plan into action ahead of time. There's 2 million people. If you plan to get out of here, there's 2 million people in Broward County. So if you're planning on evacuation, 2 million people aren't going to fit on our roads at one time if you're planning on getting out. Just the food for thought, So that's why. So enact a plan and stick with it and get out. As far as sheltering in place, I always like to try to tell people when I do these little speeches and stuff that I can make an argument for sheltering in place for, say, a Category 1, which is like up to 95 miles an hour, if you have a good, solid structure that you're in, with windows or shutters and that kind of stuff. I can't really make a case for anybody staying here for anything that's 95 miles an hour and up. Like, almost what is the point of being here with same winds over 95 miles an hour? Because what are you going to have? Like it's been said, water's going to be an issue, power's going to be an issue, air conditioning, elevators, all these services and stuff that we're grown accustomed to are not going to be available for, you know, whatever extended period of time and and the intensity of the storm and stuff. So what's the point of staying? There really isn't. There really isn't. So, and on that same note, with the 50-mile-an-hour wind, even after the storm, say we have a significant hit here, say a category 3 above, 3, 4, 5. You guys have seen what happened to Lee County with Hurricane Ian when they got hit by a Cat 5 hurricane. It's utter devastation. It's life-threatening. So, and the ability to communicate with fire rescue with anybody is just not going to happen. Everybody depends on these today for everything. They're not. It's going to be a worthless brick. It's going to be a paperweight if you have anything significant. Most towers are designed for about 110 miles an hour, 115. If you have anything significant, these cell towers are going to be pretty much gone. Even if we don't have anything that significant, you lose power. Most of these things, cell towers are towers. They take power to be operated on. You're not going to have a cell phone for the most part. Some of them have battery backups, but they're usually about 6 to 8 hours, cell towers. So calling 911 or even calling the county, and those things are going to be impossible. You say, oh, well, I still have a landline. Well, do you? Because a lot of landlines now are operated through the internet.
Yeah, they don't work.
So if you think about it, on top of that, if you do have a traditional landline, telephone poles are going down the same way the power is. So I do give a lot of credit to like the FPNL and Broward County and stuff about what they've done as far as infrastructure. But still, you're going to be responsible for yourself for quite some time if we do have a significant impact here. So that's just mainly food for thought, and it really is, for just to speak from being out on the street, when you do have a significant storm, and like I worked in Lee County with Hurricane Ian, when you see the loss of life firsthand, it has an impact on these people that run the calls. So just keep that in mind, like we all need to do our part, not to be the victim. All right? Any questions or anything?
So I suspect almost everybody here knows everybody else in the panels but me. And so real quick, I was going to tell stories, but it's really hard for me not to. So I am a Broward Health alumni. I saw Broward Health hands back there. And okay, yeah, thumbs up. In 1992, Hurricane Andrew goes through. I'm at Broward Health. John Jeans, who was the CEO of South Miami Hospital, had been a Broward Health alumni. And so we put together a bunch of trucks of supplies, blankets and water and food and things, and off we go driving through Dade County with, by the way, no stoplights, no stop signs, no direction. Of course, that's Dade County any day. My office is in but with Andrew, it was a lot more interesting, but it's actually Dade every day. So we get down to South Miami. And so we said, okay, we're here to help. And John said, I don't want your help. The chiller's fallen off. There's no power. There's no security. We have nothing. We're no longer a hospital. He said, we don't need your supplies. We don't need your staff. We don't need your water. But I'll tell you what I really do need you to do. Could you take our patients? And so I organized the transfer of all the South Miami patients from South Miami up to Broward Health. And so all of a sudden we have all these patients coming in by ambulance. I think I'm doing a great job. The CFO meets me at the door. And she says, I've got a question for you. Yeah, look what we're doing. We're doing good. We're really helpful. And she says, who's paying for all this? I didn't quite think about that. And from that event came the very first mutual aid agreement, I think probably in the country, in which all the hospitals, or a lot of the hospitals in Florida, agreed to support each other during times of disasters, recognizing that we believe some hospitals would be hurt, others could help. Fast forward from 1992, just after 9/11, I get a call, doing a project for HHS. I get a call from the Pentagon. The Pentagon says, we're going to put together a joint civilian military team to be able to prepare for mass casualty events at Super Bowls. The very first Super Bowl after 9/11, there were about 70 credible events. And so the question is, what do you do if 70,000 people are impacted by mass casualty? And so I became part of that team. Then HHS after that said, oh, by the way, we have an opening in Alabama would you go to Alabama, to the University of South Alabama College of Medicine, Brian's an Alabama guy, so I have to do a shout out for Alabama, and said, would you go there and would you help them get organized? So I went into the university and I said, sure, I'm happy to be here. I'm here for 90 days. 90 days, and that's it, I don't want out. And they said, okay, here for 90 days, go up to the very first Bioterrorism Disaster Preparedness Conference up in Montgomery, and then come back and we'll figure out what you do. So I go up to the conference, my 10 minutes is going to be gone, right? I really do have 20 minutes. So I get up to the very first bioterrorism conference, and there's a guy there from like the fledgling Homeland Security, and I just put my hand up, and I said, what's your healthcare response? What's your healthcare plan for mass casualty? And the guy looks down at me, and has sort of Ray-Bans on, not to pick on anybody, it's like Colonel in the Army, takes his Ray-Bans off, and he says, when we have an event, you just tell your doctors get their BMWs, and you go where I tell them to go. Well, I'm not really all that shy. You probably haven't noticed that, right? But and I looked up and I said, so that's your plan? I said, that's the plan. I said, that's the stupidest plan I've ever heard. Well, that really didn't go very well because I was new, but as Don Williamson, who's the public health director, came up to me afterwards and said, what do you think you could do better? And I said, well, it's a pretty low bar. It couldn't do worse, right? If your plan is to tell our doctors get the BMW and go where you tell them, I really can't screw this up, right? Because that's a pretty low bar. So my 90 days now, I'm on my 24th year of support. 10 years physically there. We built a training center, built a data integration system behind hospitals, special needs shelters, and public health all together. This year we're actually adding the trauma routing systems and trauma as well. We're on my 24th year of working there. And so if there's been a storm, a tornado, or COVID, we've been involved, and it really has been a wonderful, wonderful experience for us. And so my 90 days have been a bit long, but we've learned a lot of lessons. I had 5 feet of water with Katrina. I heard Bill's comment about FEMA. You know, funnily enough, the FEMA guy comes to my house in Theodore, across the street from a mini horse farm. Well, so I'm there. I'm there, right? I am your guy, across the street from a mini horse farm. So FEMA shows up to me and looks at me, and we have a lovely house in front of the water across from a mini horse farm, and the guy says, I think you can afford this. I have 5 feet of water in my house. I think you can afford this on your own. You got in his car and drove off. So that's my FEMA story, but I'm sure your recommendation is good for everybody not to call a car off. So now let me tell you why I'm here, right, and just share some thoughts. One, this is a really important conference. It's a really important moment. One of the things that's been happening over the last couple of years is that whether it's climate change or global warming or just bad luck, is the storms are getting far more intense, far quicker, with far less warning. And if you're like me, generally what I do the night before, you look at the cone of uncertainty and you look at sort of the strength of the storm and you go, it's just a depression, it's no big deal. So, you know, historically, you have 4 or 5 days, think about, what do I want to do? I'm not really sure. That's not true in today's environment. Today's environment, it's just as likely you go to bed with a depression, you wake up with a Cat 4 or Cat 5. The time to plan is now because Mother Nature is conspiring against you. Secondly, one of the problems, and it's a good problem to have, is I think about the disasters with muscle memory. It has been 8 years since Irma. It means a lot of people are new to this area. They don't have hurricane experience. It's been 20 years since Wilma. You know, Brian's still talking about Wilma. It's been 20 years since Wilma. And so we don't have a lot of muscle memory about what do we do. Did we register in the right places? Do we have the right go kit? Do we have the right things? Have we done what we need to do because Mother Nature's given us a break? Now, those breaks have a shelf life to them. And so the conference is really important because this gives you a chance to hear from very valued resources about what you need to be doing now while the blue skies and the sun is out, because we don't have that currency. It's really funny about memories, by the way, with storms and disasters. They get softer and they get fuzzier over time, right? Things that were horrible to us as we were going through them, suddenly, you know, 8 years now, I remember that. Yeah, we got through it now, it's no problem. Well, it was 8 years ago, you just don't remember. So use this time and use it wisely, in my opinion. Next, I have a phrase, you can borrow it if you like, and it's called yo-yo. And yo-yo stands for you're on your own. As you're sitting here today and you're making decisions about what do I do, begin with designing and building your own plan from you out, right? What's the right thing for me to do? So let me just give you a quick litmus test. This is a caregivers conference. I tend to bucket caregivers into two boxes. If you're caregiving for a relative, right, and in Dade County, my office is in Dade, there are a lot of grandmothers or grandfathers, mostly grandmothers, who live with their families, right? So when you're making a decision as a caregiver for an elderly patient that's part of your family, that decision's pretty easy. If we're going to evacuate, we're going to evacuate as a family. If we're going to go to a shelter, we're going to do a shelter as a family. If we're going to stay at home and we're going to shelter in place, we're going to do it as a family. But if you're a professional caregiver, you have two accountabilities there. You have the accountability to the person you're caregiving, right? That individual. But oh, by the way, you also go home to your own grandchildren, your own spouse, your own children, and all of a sudden now you've got to make two decisions. What's the right decision for the senior that I'm caring for, and then what's the right decision that my family wants me to do? So if you go home and your husband says, we're getting in the car and we're leaving tonight, remember you've got an accountability as well. So the very first thing you have to do is, how will I make decisions both for the senior that I'm responsible for and my family, realizing that sometimes those decisions will be in conflict. And think about those before you get started. Next, disasters are about stuff. They're about stuff. So the question is, you want to look at is, what's particularly my seniors' stuff capability? What do I mean by that? So in the programs that you've got here, there's this wonderful, wonderful list. We've heard about Go Kits now from probably almost every speaker, and we have all kinds of things. Great, great, great list. So my other day job, now that I'm back and moved back to South Florida, my other day job is I'm part of a senior leadership team, and we run senior care centers, medical centers, mostly in Dade County, a little bit in Pembroke Pines. I will tell you about our average senior. Our average senior has a $900 a month Social Security check. $600 of it goes to a couch. $300 is what they have left over for living. When you walk into them and say, by the way, I want you to spend for a Go Kit, they don't have it. They are food insecure, they're power insecure, they're rent insecure, they're transportation insecure. We provide 950 seniors breakfast and lunch every day, not funded by Medicare. We provide 4,000 seniors transportation every day, only 40% covered by Medicare. Why? Because the seniors need help, and that's part of our commitment back to the senior community. So as you start to look at that list and you're sitting down with your senior, particularly to my friends in Dade with the, that I'm looking at, you start to look at that. Here's the challenge that you've got. Okay, let's go buy an air mattress. It's a great idea, right? I love it. Let's go buy MREs. I checked Amazon this morning. You can buy MREs for 12-pack for $42. But you're talking about our patients have $20. Maybe they have 20 meals ready to eat. Meals ready to eat. Those are the pre-packed ones that you don't have to cook. They're kind of self-heating, and they've gotten much better over the years, right? In my opinion, much. Oh, okay.
They're better.
All right, they're better. All right, they're better. All right, they're better. But the problem is, right, if I were to ask our seniors today, by the way, let's go shopping and put together a Go Kit, they'd say, can I do it for $10? Because that's all the money I've got. And so one of the things I would encourage you to do is reach out to Charlotte and reach out to the area-wide agency and say, where is their help? Go Kits are great. The list and the program are wonderful and absolutely great. But if I can't afford it, what do I do? What do I do? It's another reason, by the way, back in making decisions for fragile seniors, I would probably err whenever possible in going to a shelter. Why? Because the shelter provides food, they provide comfort, they provide safety, and you don't have to worry about 3 flights up when the senior has 1/2 piece of watermelon left, and that's their entire food for the next 10 days, and Charlotte knows that because she's run probably the most successful feeding program. And so think about the stuff ability. Now, I'm going to close because I know I'm at time. I know that card's coming, I know. Let's talk about clinical conditions quickly. We talk about ESRD, but there are other things, right, that require. What if I have surgery scheduled? You know, it's going to be held or not held. What if I've got, we've talked about Alzheimer's briefly, 70% of all patients with memory disorder live at home. We know that their needs are different than other needs. We know they don't like loud noises. They don't like new people. Sometimes they're prone to acting out. We know that at the end of the day, they will wander. Right? And so part of it is, particularly if you're a caregiver for a patient with memory disorder, Alzheimer's, dementia, you need to be talking to the folks here in this about what do we do, how do we do it, what do you need from me? I asked the question to Andrea earlier about when special needs shelters, do you need to bring a caregiver? You know why I asked that question? Because in Alabama special needs shelter, a 90-year-old woman brings her 92-year-old husband as her caregiver. So the truth of the matter is, right? So the truth of the matter is, don't always think that caregiver that's coming is going to actually have a whole lot of support. The other difference, by the way, between Alabama and Florida, because I've heard this now 3 times, it's a lifeboat, not a cruise ship. We always say it's a lifeboat, not a love boat. Although, in my experience, we've had 2 marriages coming from people who met each other in our shelters. One of them actually got married in the shelter. And so I'm just telling you, so it does work for most parents. One of the things that you want to make sure that you're doing is for the shelter, the very first thing that the folks in the shelter are doing is they ought to work on getting you out of the shelter. How do we get you back home, or how do we get you to safe haven? Make sure that you've got that ability, right? What am I going to do when it's over? And what am I going to do when it's over if my home is not? What am I going to do? What is my post-shelter plan, and how do I work with Andrea, and how do I work with the team in order to be able to do that? Finally, my last comment in terms of the hospital side. My experience in hospitals, I don't know if Memorial does this or not, it's another reason. You come in, that's awfully kind. I don't know if Memorial does this or not, but I do know that most hospitals, when they convert from the power grid to generator power, they tend to lock down the hospitals. And there's a reason for that, because generators are not as efficient at providing air conditioning as the grid does. So what happens with hospitals is they have to slowly raise the temperature in order to meet what the generator is able to do. Hospitals actually sweat, interestingly enough, because the humidity goes up. So you have to make sure that you've got Memorial on your speed dial to make sure that you get there early enough, because if you wait too late in the storm, one, not only is transportation not running, but the hospital themselves, if they've shut down, I can tell you in my experience, we don't let anybody at that point, because you wind up losing the entire hospital because of the humidity increase. So make sure that your plan, if it includes Memorial or Broward Health or another hospital, make sure you know to act early, to get there early and be there, because otherwise you might get knocking on the door and it's really, really, really hard to get involved. So I will leave you with just this. Have a plan, work your plan, and plan for the unexpected. You're not alone. You may begin that journey with what's right, the right thing for me, with the right challenges for me, but at the end of the day, you have so many resources in this room around you that are here to help you, that you can be successful in navigating this, so that when you get done, you have new stories to tell, and you just come up here and join us. Thank you very much.
Thanks so much. I'm a geriatrics physician at Southeastern University, and we take care of nursing home patients as well. And we had certain disasters with the nursing homes who were not equipped in the hurricane. But are all nursing homes able to be a shelter or not? They're not all able to withstand hurricane force winds, right? So they have to decide what their capability is.
So one of the requirements that they'll have with licensing with ACA is that they need to have the plans in place in advance. So either they are hardened facilities which can shelter in place, and that could mean different things. So you can be hardened to a level 1 and then there's a 5 and they're not the same. So they have to understand their risk, and they have to have plans to evacuate to a comparable location. So nursing homes are not to bring people to the hospitals unless they have a plan or an agreement. So not every nursing home can, but every nursing home has to have a plan, which is part of their licensing of how they're going to maintain the care for their patients.
And from the times I used to be a medical director at a nursing home, we prepared the kits for the patients in case they needed to be evacuated, right? Their medication list, a basic history, some key information, so whatever site they ended up in, they could get at least somewhat appropriate medical care.
And that's definitely a best practice. The other part is the transportation of understanding how you're going to get them from where they are to that contracted location. Because it's not necessarily, as all of these things are going on, it might be hard to call the city and say, we need a ride, and the city's gonna say no, so it'll go to the county, and that'll just add that extra delay and that level of stress to everyone.
So to have the plans in place beforehand.
Absolutely, for transportation, and then the backup transportation, and also multiple locations, because in blue sky, sure, I can take your 120 patients, and then something happens and they call and I can take 10 patients, and now you've got to scramble. So you want to have multiple alternate locations outside of the area as well. So having your evacuation site, and I saw it with the health department, I think it still happens. I'm going to evacuate to the nursing home that's 4 blocks down the road because I know them. Well, they're evacuating too. So it should be inland, it should be in Miami, it should be, I can tell you for the hospital, I have agreements to evacuate all the way into Orlando. And if I can't hit Orlando, I'm calling the state to see if we can go further. So it needs to be multiple locations out of the area, and then your transportation, I don't need you to drive this person 10 blocks, I need you to drive this person to Jacksonville. Is that part of the agreement?
And a quick question, so many patients are using, or individuals are using CPAP. Does that really qualify for a special needs shelter? I heard that mentioned.
Josette, I think CPAP is special needs,
No.
but it's not higher level of care.
CPAP can be for general.
Oh, general pop, okay, general pop.
I think it's a pretty high level for special needs.
For special needs, CPAP is considered one of the medically necessary devices that you will be found eligible for a special needs shelter by Department of Health. So just think CPAP, it could be your insulin that requires refrigeration or other medication. That's also considered a special need. So anything health and medical wise that is going on with you, it's important to put that information on the application because that information is what Department of Health will utilize to determine which shelter environment is best for you. So please, I know it's a little lengthy and it asks a lot of questions, but it's asking a lot of questions so that we can make sure that you're in the most appropriate place should you evacuate your home.
My question is for Natasha. I know you say you work with a lot of the hospitals, and previously with evacuating, again, we run into a lot of the homeless seniors not having a place to go. So what do we do with that? Do we call like Broward? Do we call Holy Cross? What is the plan with that? Because they do come to our center and we really don't know because they're not registered to, go on to the VPR because most of them don't have identification. They live out in the streets and everything.
It's so, you wanna take,
What
so.
city are you calling from?
I'm from the city of Deerfield
Oh, you're
Beach.
here.
I'm sorry. I look, I get this all year long. Once, June 1st come in, with the hurricanes, we get bombarded with a lot of questions, and the first thing is the community is coming to our center and everything. So, I just want to be well prepared this year with, directing them or gearing them to the right person or the place.
So I would say that in those scenarios, first wherever, like education is the first part of it. For them to understand how it works and where to go. So I think it's a great question, thank you. As far as, so the first line is trying to get them registered. Not having a permanent address and that is going to be very difficult. So I think having the vulnerable population registry in addition to the education piece so they know where to go. If they come to a hospital and they are not pre-registered, then they are going to be referred to a general population shelter or referred to 311 to make that phone call to be able to really determine, do they need a higher level of care, do they need a special needs shelter, or do they need a general population shelter? I think the problem, and I'm not so much on my memorial hat, but when I was on the health department side before, one of the biggest issues that we've always run into is it's 71 people on a registry, and then in the last 24 hours, if I remember from Maria and Irma, we had something like 3,000 calls in the 12 hours leading up to the storm. And it is heartbreaking to hear that person who is eligible, who should have been allowed, saying the wind is already blowing, we can't come and get you. So having that education now, if there is a way for vulnerable populations, and Josette, I'm gonna kind of aim back at you again, as far as for that population, can they use the center as an address if an address is needed? Can that be that point that at the time of an event, that's how you can reach them to be able to have that call that happens from the vulnerable population registry right beforehand to say, where are you? Are you still in Deerfield? Are you now in Fort Lauderdale? Are you in Sunrise? To be able to find them and then reach back out. I don't know, I'm ashamed to say with that population, do they have cell phone numbers? Is it a common thing that those with cell phone numbers can use those for the registry and others are educated that in the event of a storm that the center is going to be open up until whatever time frame or whatever conditions warrant? So right now it really would be education and almost a case by case, but trying to find a way to kind of reach that population because we want to make sure that we are accommodating everyone that we can. We want everyone to stay safe, but realistically speaking, we also know that we're going to miss people if it's not a whole community getting the information out and then maybe finding some unique ways to keep them connected to the services. And Josette, I don't know, on your end, since this is kind of your world on the special needs side, for that population, what's special that you can do?
I do have people that are homeless that have applied for these special needs shelters, and they are processed. As long as they provide an address and most importantly, a phone number, we can have them registered. Now, if we activate and they are registered for, let's say, TOPS, I'm gonna tag team Paul. It's important that if they can be at that address that they registered, that would be ideal for Paul and his dad, right, Paul? Now, they do provide verification of address when they do call the call center back to verify that the address on file is the address that they can be picked up from. But definitely they have to have some way of being communicated with, i.e. cell phones. But yes, they can register for the special needs shelters. Andrea, I don't know if you, are you familiar with Dr. McDougall? And I know there's like some people with human services that kind of assist.
When it comes to our homeless centers, our HACSA homeless assistance centers, we do have a plan as far as how they need to be evacuated. None of our 3 major homeless assistance centers in Broward County are hurricane hardened. So as soon as we do get an evacuation order, that's one of the first evacuations we do is evacuating all of our homeless assistance centers. And there is designated shelters that fall under my jurisdiction that we will then relocate all those folks to. And with Paul's team, we actually have specific ways of, we're they're gonna send 6 transit buses to this center, and they're gonna take them and bring them to this shelter. We're sending 4 transit buses to this shelter to bring them here. So we have a whole plan around as far as how we are going to evacuate our homeless population. And when it comes to the unhoused population, we also have some designated places that people can go to get that transportation. So they can go to, there's various different addresses that we publish, and it is on our websites, that if the unhoused population need a place to go, is they go to one of those locations, a transit bus will come, pick them up, and bring them to one of our shelters. And then when the storm is over, as Paul mentioned, we will also make sure they get back at the end of it. So we do have all those plans in place.
And my last question is, I did have like some of my seniors asking questions, like what Carl was saying there on fixed incomes with supplies and what they can bring to the shelter. One of the seniors wanted to know, like the folding lawn chair, is that acceptable for them to bring to the shelter if needed for them to sleep in?
Yeah, that would be fine.
Okay, thank you.
I'd like to ask, on behalf of my mother who has macular degeneration and low to no vision, if she does need to go into a general population or one of the special needs shelters that we, of course, would be registered for, how are those set up for people with low to no vision to be able to move around? She would have a caretaker, either me or my sister, but would she be able to navigate? She is mobile, but would she need to bring a walker to kind of make space? We've heard that the general shelter in the gymnasium, like a 5x4 space sign, are when I see pictures of previous disasters and evacuation, everybody's just crammed together and it's very hard to walk. Can you please address that scenario? Thank you.
So we try to plan our dormitory areas within the shelters, and we do reinforce really that we need to keep those aisles of walking aisles open for various different reasons. Certainly for fire hazard reasons, but also to make sure that we can keep, to your point, that people can walk around. When we do deploy our resources out to the shelters, including the general population shelters, they will get a functional needs kit, and in that kit will be walkers, canes, maybe a couple of wheelchairs, some things like that. So even if somebody gets to one of our shelters and needs a walker and doesn't have one with them, we do have some available to be able to provide at the shelters as well. But we will do our best to make sure that that kind of, that we keep this, kind of organized so that we can get around.
You guys did a fantastic job. Thank you so much.